Hi, my name is Tammy Fletcher, and I'm a licensed marriage and family therapist in California. In my practice, I work primarily with highly sensitive people, or HSPs. That's a trait also known as sensory processing sensitivity. Being highly sensitive is not, in my opinion, a disorder or a pathology in itself, although HSPs may face their own unique set of challenges living in a noisy, crowded, extroverted world. Being highly sensitive is an innate temperament and one I believe has a biological base. People who are highly sensitive, while they may have a good deal of shared understanding and experience with other HSPs, are as uniquely individual as any other group of people. The lack of awareness about high sensitivity is gradually improving, but still has a long way to go. A Google search for common questions about HSPs showed questions like, are HSPs intelligent? Or can an HSP get angry? I've gathered a pretty good amount of experience and education over the years providing psychotherapy to highly sensitive people, and I'm an HSP myself. But hands down, the greatest source of information that I have found, and one that I return to again and again, is the work of psychologist Dr. Elaine Aaron. I'm going to link to Dr. Aaron's website in the description bar below. If you're looking for a comprehensive body of work, including the latest research, brain studies, and her brief free assessment, if you are curious whether or not you have the highly sensitive trait, you can take that at Dr. Aaron's website. hsperson.com is definitely the place to get started for more information. And I will just make this video a blanket citation of Dr. Aaron's work because she is truly the pioneer in this area. When a highly sensitive person comes to see me, sometimes they have been in treatment with other mental health clinicians in the past and not always felt as if their needs were met or understood. In some cases, they have even been misdiagnosed with mental health disorders, which on the surface may mimic the unique features of sensory processing sensitivity. I'm going to share some examples to illustrate what I mean. Let me back up for just a second and talk a little bit more about what an HSP is. It's thought that highly sensitive people have an increased central nervous system sensitivity, and this would explain the struggle to filter out overwhelming sensory input, to sort out what they should focus on, and the need to decompress and recharge. Some features of being highly sensitive include, obviously, a heightened sensitivity to external stimuli like bright lights, loud noise, scratchy fabric, or strong tastes and smells. What can be even more challenging is how deeply HSPs can be affected by crowds of people, too much going on around them at once, and possibly the need to structure their lives and environments in a way that allows them to function at their best. Unfortunately, at first glance, some of those tendencies can appear to check some boxes on some of the criteria for mental health disorders. HSPs have been misdiagnosed with mild autism, social phobias, ADHD, developmental delays, PTSD, obsessive compulsive disorder, depression and anxiety disorders, somatoform disorders, body dysmorphia, and the list goes on and on. Now, can a highly sensitive person have any of the disorders that I just mentioned? Yes, of course they can. Those and more. HSPs are not immune to any clinical diagnosis. Just because an HSP shows introverted tendencies does not mean he or she has social phobia. Being too overwhelmed to focus in a chaotic, noisy work environment doesn't necessarily equate to an autism spectrum disorder. We've got to look deeper. According to Dr. Elaine Aaron, HSPs make up 20% roughly of the general population, but they are as high as 80% of therapy clients. As mental health clinicians, we have to keep this in mind when we're doing intake assessment and treatment planning. It's vital that clinicians gain a working familiarity with what heightened sensory sensitivity looks like. Do some reading, bookmark Dr. Aaron's HSP self-test, even take it yourself to get a sense of what it's measuring. It's free. It takes just a few minutes. It's eye-opening, and it can expand your diagnostic toolbox. There's an old phrase that goes, when you hear hoofbeats, look for horses, not zebras. Highly sensitive people are zebras. Don't miss them. Thanks so much for watching. I welcome your questions below, and I will see you next time.